Now, once you have your baby, because the skin all of a sudden becomes more wrinkled, those stretch marks can be more visible. So some things that you can do include massaging that skin. The more blood flow or fluid to that area that you can get, the more your body can begin to heal that tissue or begin the fading process of the stretch mark. Hello and welcome back to Nurse Onyi Teaches. My name is Onyi. Just about everyone who has seen a pregnant woman can easily identify some of the changes that are going on in her body. But did you know that some of those changes do not occur only while a woman is pregnant? There are so many differences that a woman will experience once she gives birth to her baby that many first-time moms do not know. So in today's video, we will be discussing some signs and symptoms that occur in the postpartum period, just to give you a good head knowledge and prepare you for what may be. Now, keep in mind that every woman does not deal with these signs and symptoms, and that you should also be talking to your personal doctor who knows your health history so that the plans of care that are created addresses your particular needs. Without further ado, let's jump right in. One of the first things that a lot of moms notice after they give birth is that they begin to lose their hair. Now, when a woman is pregnant, increased blood flow alongside hormonal changes causes her hair to grow not just longer, but also fuller. When you give birth, however, your body begins to re-regulate those hormones, so the benefit of that increased hair growth begins to be lost. And as your body begins to shed that postpartum hair, you notice that it falls out in patches sometimes, and a lot of women can be distressed by this. Some things that you can do to help your body manage postpartum hair loss include minimizing your stress. Stress can lead to hair loss whether or not you are pregnant. You also want to keep taking your prenatal vitamins so that you have your body's stores built up so that your body can continue to get good amount of vitamins and mineral and sustain your hair growth. You also want to make sure that you eat a diet that is rich in protein, that you have a diet that is rich in iron, as these two things can help to boost your blood flow, keeping your hair growing at a steady pace. Another thing you can do is to massage your scalp. Increasing the blood flow to your scalp can help your body to grow your hair naturally so that you can reduce the risk of that hair loss that accompanies the postpartum period. Now, if your hair loss is extreme to where you notice a lot of patches or balding spots, you may want to talk to your primary care physician or visit a dermatologist just to make sure that there's nothing underlying that could be causing the extreme hair loss. Now, this next postpartum change is more frequently seen in women who give birth vaginally as opposed to those who give birth via the cesarean route. I say more frequently because some women actually attempt a vaginal birth, but it does not always prove successful, so they end up needing a cesarean section. And that change is a swelling in the vaginal area and in the anal canal. Now, when you are getting ready to give birth to your baby, during the pushing process, a lot of tissue, muscles, and the surrounding area becomes engorged with blood because that area is working really hard to stretch and move out of the way. The problem with this is that as soon as the baby is born, that swollen area now proves very difficult, allowing a woman to have a bowel movement and to even urinate. Sometimes when you pee, once the acid in the urine touches that sensitive and broken tissue, it can sting. There is also an increased risk of infection because swollen tissue increases the moisture and the warmth in an area where bacterial growth becomes more favorable. Some things that can be done to reduce vaginal and perineal swelling include a cold compress. Your doctor may also prescribe something called witch hazel to help soothe that area. You can also use a sitz bath, which is sitting in warm, clean water, which can help to cleanse the perineal area, as well as introduce new blood and helpful blood cells to help the healing process move along. You want to avoid taking tub baths. Tub baths can increase the chances of infection by introducing bacteria to a swollen area and giving them a nice warm area to breathe, causing your body to grow things that it should not be growing during the healing process. Also, change your pad frequently. Make sure that you are removing your pad at least every 2 to 4 hours if you can, so that that blood is not sitting there allowing bacteria another medium to grow. Now, this next postpartum change comes as a shock to many first-time moms, but moms who have given birth before can attest to this, and that is larger breast size, whether you choose to breastfeed or not. Once you've given birth to your baby, your body upregulates or makes a higher quantity of a hormone called prolactin. Prolactin is the hormone that helps your body make breast milk. As your body begins to produce this milk, it begins to store them in the milk ducts, causing your breast tissue to expand. This production can continuously increase, peaking around day 3 of giving birth to your baby. Now, if you choose to not breastfeed your baby, some things that you can do to suppress the overproduction of milk include wearing tight bras. You want to limit any stimulation to the chest area. Also, you can try applying cabbage leaves to your breast, because cabbage leaves can actually help suppress the creation or the making of milk. If you choose to breastfeed, make sure that you are nursing your baby on a schedule. Usually those first few days you want to breastfeed every 2 to 3 hours, depending on your baby's demand. If your breasts get too engorged, you may want to take a shower to just help that excess milk to flow out of your body. The one mistake you don't want to make is to pump in excess of your baby's demand. The more you pump, the more message you send to your brain to make milk, and your brain will continuously respond to that, which will not only affect how much milk you make, but it will also affect the quality of the milk that you are making. Make sure you wear a comfortable bra, not a larger bra, to accommodate your breast size, so that you don't deal with excessive slackness or dropping, or the skin sagging once you quit breastfeeding your baby. This next change can happen while a woman is pregnant, but becomes more obvious after the baby is born, and that is stretch marks. There are many risk factors for getting stretch marks, and that includes being extra young, having a family history of stretch marks. So if your mom had stretch marks, there's a chance that you will deal with it also. If you gain weight too rapidly during your pregnancy, you stand an increased chance of getting stretch marks. So you want to gain weight at a steady rate. Now, once you have your baby, because the skin all of a sudden becomes more wrinkled, those stretch marks can be more visible. So some things that you can do include massaging that skin. The more blood flow or fluid to that area that you can get, the more your body can begin to heal that tissue or begin the fading process of the stretch marks. Make sure you are taking enough fluids. Fluids will help your skin stay nice and moist and prevent dryness that can even further complicate stretch marks. You can also eat a diet that is rich in a protein called collagen and hyaluronic acid. These two help to increase the stretching of your skin, reducing the risk of you getting stretch marks in the first place. Now, if you feel like the stretch marks are a bit unsightly or you would like to get rid of them, you can talk to a dermatologist, and there are some skin therapies that can be used to decrease the visibility of stretch marks. Keep in mind that once stretch marks appear, they do not go away. They can just fade and become less visible over time. Now, another issue that a lot of moms deal with after giving birth is increased acne formation and skin tags as their body tries to make sense of their raging hormones in the postpartum period. You don't want to treat this acne the same way you treated the one that you dealt with while you were younger or during your high school years. In fact, a lot of the products that you use during your teenage or younger years may be irritating and make the acne worse if you use them in the postpartum period. What you want to do is wash your face with hypoallergenic soap and just plain water. If you need to apply some type of cream to your skin, make sure you look for cream that is rich in vitamin C, as that can help to restore a nice natural balance and help your skin with the healing process. If you deal with skin tags as a result of pregnancy, you may want to keep an eye on them just to make sure that they are healthy and normal. You may want to ask a dermatologist to examine them, especially if they appear inflamed or infected, and if they need removal. Dermatologists can do this. There are several procedures that are available. What you want to do on your end is wear comfortable fabric. A lot of skin tags appear because of irritation to the skin. So if you're wearing fabrics that are itchy, especially in the armpit or the neck area, it increases the chances that you will have outbreak of skin tags. Comfortable fabrics, however, come to soothe and decrease the risk of this. So wear comfortable fabrics like silk, linen, and make sure your cotton is light and breathable. Now, last but not least, another thing that many moms notice is that their shoe size grows after they give birth to their baby. When you are pregnant, your body releases a hormone called relaxin, which comes to help the joints all over your body to relax to support your growing baby. The problem with relaxin in the foot is that it also relaxes the joint in your toes and all over your foot, increasing the chance that those relaxed joints will stretch, increasing your shoe size. Now, some moms are fortunate to have their foot size go back to normal normal after giving birth, but many women report a growth in their foot and thus their shoe size. For me, I went from a size 6.5 before giving birth to now a 8.5 after having 4 children. I look at it in a positive manner. I have 4 children to show for it, and I can go shoe shopping. So that's a win-win in my book. Now, if you have learned something in the content of this video, do not fail to give it a huge thumbs up. Make sure you hit the subscribe button and turn on your notification bell so that you are made aware of every time a new video is uploaded. Share this video with somebody who you feel can learn from it. And don't forget to come along with me as we build this growing community of empowered learners who are becoming active participants in their own health care. I wish you health, wealth, and stealth as you navigate your pregnancy and postpartum journey. And until the next time, be blessed.